Today, we're excited to welcome our guests from the Better Together project for a look at Indigenous-led change to local healthcare. A little bit on that project. So, the Better Together project is an act of cultural reclamation, preservation, and reconciliation dedicated to reawakening the ancestral healing practices within Wood Buffalo in Treaty 8 territory. This collaborative project is working with First Nations, Métis, and Inuit communities in the region through a process of engagement designed to collect and integrate feedback to create culturally inclusive services in an Indigenous health space at the Northern Lights Regional Health Center, or NLRHC. The Better Together project will change how healthcare and healing are approached locally, creating a safe space for Indigenous wellness for First Nations, Métis, and Inuit peoples. We are very honored to have some spectacular guests with us today. We have Adrienne Lachance and Dr. Stephanie Montesanti. We also have Jennifer Best and Mark Yu, and those two will be our guest speakers. So as a little bit of background, I'll give you some bios, and then I'm going to turn it over to Jennifer. So Jennifer Best is the health director of the Athabasca Tribal Council, and for over 26 years, she has worked as a child and youth counselor, guided by a passion for supporting others. In her current role, the health director for the Athabasca Tribal Council, she works alongside communities to improve Indigenous health outcomes in the region. Jennifer also served on the previous Health Advisory Council and various other local boards. These roles have helped her understand how to navigate complex governance systems while staying rooted in addressing the community needs. Jennifer consistently finds balance through time in nature and with family, who inspire much of the work she does. We also have Mark Yu, Senior Consultant with Acute Care Alberta. In his current role at the ACA Design Lab, Mark and his team lead a practice that combines people-centered design, systems thinking, social justice, strategy, and execution to deliver a unique approach to tackling complex health-related challenges. Much of this work involves creative group facilitation, community and citizen engagement, and strategic planning across all levels of the organization. In previous roles, Mark was entrusted with leading multidisciplinary teams to co-create people-centered solutions across sectors of government, education, retail, finance, utilities, and healthcare. His experience has also led him to gain expertise in a variety of functions, including strategic designer, service designer, digital strategist, project lead, user experience consultant and researcher, design facilitator, and educator to support organizations on their journey to deliver great value to people. I will now turn things over to Jennifer to get us started.
Thanks so much, Alicia. Tenze Aglandite. Before we start in all the work that we do, we like to start ourselves in a good way. So we've invited Adrienne Lachance, who is a knowledge keeper with the Athabasca Tribal Council, to open us up in prayer. So Adrienne, I turn it over to you.
Thank you, boss. Kita tamskat na agakyo na naskumtan tayo moksimanto. I welcome you all in a good way. Pray with me the way you were taught to get this day started in a good way. Mamuhtayo mo sa minan pego na naskumtan. Magigway niya ipegyo siya agakyo tepsko gagisimuro mo na naskum. Ospaga na sa tepegyo siya. Magigway ni api kaya tanagagisimuro mo na naskumtan. Hi. Have a good day.
Hi. Thank you so much, Adrienne. The Better Together project is a unique, as you've already heard, a unique partnership. And so we always tell this with a story. We're very, we like our stories at the Tribal Council. And so the story goes, there was a fourth floor in the hospital in Fort McMurray, and that was our long-term care facility. Through tremendous work, we were privileged to receive funding in the region to build an independent long-term care facility that we now call Willow Square. And in the big transition, that left the fourth floor of the hospital entirely empty, vacant. And so there was a very ambitious chief operating officer at the time. His name was Murray Crawford, and he reached out to the Athabasca Tribal Council and said, hey, we have a really unique opportunity right now. We have a blank slate. Perhaps we could come together and figure out how to use this space. And so that journey began, and it's been a very long journey bringing on our partners. We worked with Alberta Health Services, or formerly known as Alberta Health Services at the time, and we entered a memorandum of understanding with the Northern Lights Health Foundation, Alberta Health Services, and the Athabasca Tribal Council. And that memorandum of understanding really talked about a desire to support Indigenous-led healthcare in the region, recognizing the number of disparities. And so the MOU asked us to understand what they were and to work with community in a joint effort to guide how we could better utilize that space. So then birthed the Better Together project. And our partnerships continue to expand and grow. And I like to say we started dating with the Design Lab and Mark and his team. And we started dating with Dr. Montesanti and her team at the Care Lab in University of Alberta. And collectively, we have worked really hard with the nations that we serve and the communities that we serve to develop a program that we believe is going to support cultural reclamation, preservation of reconciliation, dedicated to reawakening those traditional health practices of Indigenous peoples in Northern Alberta. I don't want to harp along too much of this, but we do know for generations, Indigenous people's stories of medical injustice have been too common. We we recognize that there are social disparities on how health is delivered, and we use that knowledge to help build and construct the not only the ideology of the program, but everything about it has been keeping that in mind.
And I'll just jump in and say the presentation that you're looking at right now is a document that we created as a way to build awareness around Better Together. So it's not a formal slide deck. So what we'll do is just highlight some of the content in here as Jen and I and Dr. Montesanti tell the story of Better Together and what we see it becoming in terms of an Indigenous wellness space on the 4th floor at the Northern Lights Regional Center. So we won't cover a lot of this background, but I think it's important to highlight that this coordinated response that came about as a response to health disparities in the region, as well as to embed cultural safety within the Northern Lights Regional Health Center and within the health system writ large, continues to grow. That coordinated effort continues to grow, as Jennifer said, with our membership and attention continuing to, as we like to say, spider out and it's growing legs against the backdrop of a system that we had anticipated changing, but maybe not to the extent that we see it now, which means that we are now having to explore multiple perspectives and angles in order to grow and foster support for this project, which at a time during transformation is actually quite critical. Right? This is the time when we can introduce novel innovations into a system where they're adopted as next best practice. And through this effort, this coordinated effort, the hope is that we can start to foster some of that two-eyed seeing model that embraces the Indigenous worldview, the models of care that they have within their traditions, as well as pair it with Western mainstream healthcare within an acute setting. Dr. Montesanti, would you care to share some perspectives on the data and evidence that supports the case for why an Indigenous wellness space is needed in this particular region?
Sure. Thanks, Mark. Really a pleasure to be here. So I'm the research lead consultant for the Better Together project. My team at the Care Lab, which is situated in the School of Public Health at the University of Alberta, has been supporting research and evaluation for the Better Together project. One aspect of that research has involved looking at administrative health data that helps us to better understand First Nations health service utilization and health service utilization specifically at the Northern Lights Regional Health Center, where the Better Together project is situated. And health service utilization data, as mentioned, helps us to understand what those trends and patterns are in accessing health services. What are the main reasons for why First Nations are accessing health services or care at the hospital? What are they coming into the emergency department for? And how are they leaving the hospital? So I want to make that really clear. It gives us insights into reasons why they're coming into the hospital and how are they exiting or leaving the hospital. And leaving the hospital gives us provides insights in terms of discharge or referral. And also helps us to better understand health outcomes and if there are more serious or urgent health conditions. One of the things that we have learned through the administrative health data is that just over 40% of care that is being sought by First Nations in the emergency department are for urgent reasons. And just under 40% are semi-urgent. So they are utilizing the emergency department often in times of crisis. And so that's important to note. And the other is we've tried to look and as you can see on this line in terms of what does that compare in terms of general population. We've looked at data that has been available to us through Health Quality Council of Alberta and CIHI data. But I wanted to note that our work has really been looking and providing a snapshot of First Nations healthcare experiences in the region of Wood Buffalo, working closely with nations and hearing directly from them what their interests, values, priorities are in the data and how that can help in to support health service planning and decision making. So you can see some of the numbers here. There's a lot that I could share that we don't have the time for in terms of data, but some of the things to perhaps highlight is mental health being what we saw as a key or top priority in the administrative health data as the main reason for First Nations seeking health care in the emergency department. We were also got some insights around access to primary care. And so I think everyone here knows that when there's poor or limited access to primary care, we see emergency department use go up. So the geographical context is really important to note here. So I'm not going to get into the particulars around why, but the region is geographically diverse. We have many First Nation communities who live 2 hours or more outside of urban Fort McMurray and are coming into the city for urgent care, often by ambulance. An ambulance will bring them into the emergency department. So the other concern too is that we're noting is some concerns or gaps around how they are leaving hospital. And so that has allowed us to dive more deeply into understanding what discharge experience is like. Again, because of the geographical context and remoteness in the region, if they are leaving the hospital without access to services, supports, and resources they need, that can have impacts in terms of readmission rates or bounce back rates back into the emergency department. So ensuring that they are leaving with the proper supports and resources they need, I think is really important. Important in the context of overall health system capacity as well. So I think I'll leave it there, Mark. But I think what we're seeing and learning that mental health has been a top priority in the region. We've heard that directly from nation members in terms of their own care experiences and challenges that they're navigating. And some important insights too, just around access more generally.
Thanks, Dr. Montesanti. Really appreciate that background. Just come back to the presentation here. So we know the trends, we know the patterns, we have the data, we have the evidence to suggest that an intervention is needed. And we know what the trends are, the increasing ED utilization. We know that there's increasing mortality rates across the region. We know that there's decreasing capacity within our healthcare system. And we also know that our frontline providers feel that as well. And so what are we proposing to do about it? How does Better Together impact some of these day-to-day operations, potentially help shift practice? But what are we actually tangibly talking about here when it comes to Indigenous-led change to local healthcare, or what this Indigenous-only space is meant to do? So some of the short-term objectives that we began with at the outset of this project was really around increasing safety and access to culturally safe healing practices, again, to reawaken those traditional healing practices that are currently being lost generation by generation. So seeing this as an opportunity to reclaim those, to practice them, and create a center of knowledge around traditional healing practices that are so desperately needed by community members. And we've heard that time and time again. We also sought to relieve pressure off of and reducing visits to the emergency room, recognizing that's a government priority right now, is to reduce ED use, or rather increase emergency department diversion, right? To improve acute patient flow, to support safe discharge, to improve quality of healthcare in general. Like we know what the mandates are, and we know what community needs, and Better Together is it continues to evolve in terms of how it can actually interrupt not only those patterns and trends that we're seeing, but demonstrate a new way forward in terms of how we provide holistic care to Indigenous patients, recognizing that they experience our healthcare system different and therefore may require a different solution. Of course, we're honoring local traditions, teachings to preserve Indigenous cultures, but to also share that culture with healthcare providers who have also expressed desire to embrace more of that. And then fostering collaboration across the system to the extent of integration and acting as a bridge to join services, to coordinate care, continuing that continuum of care for patients once they leave the site, and ensuring that they get home safely. We also challenge ourselves to think about this project when we say Indigenous-led, to really challenge how we think about our practices, our beliefs, our norms, our values, to really, again, honor that Indigenous-led practice of different ways of doing, thinking, being, and seeing. And that really informed our project framework here. We recognize the system that we're working against. We're not ignorant to the amount of change, but perhaps weren't expecting the degree of it, which is where we are now. But that, I think, again, that offers us a huge opportunity right now, is to look at how, as we begin to garner support for the space, as we seek funding to actually physically get it built, we are against the backdrop of a system that is in renewal. And through that opportunity, we have the opportunity to look at reconfiguring our resources to provide different outcomes. Or we also run the risk of rebuilding systems that were images of them for their former selves and continuing to perpetuate, certain harms and traditions that we continue to see and persist across our healthcare system. Through community engagement, we also learned a lot from community members. We ran an extensive engagement. Jennifer, you can jump in and speak to some of this, but our team was up in Fort McMurray supporting a lot of the engagement, speaking with community members, citizens, healthcare practitioners, elders, and really learning, hearing their stories, hearing what they felt is important to their own health, right, to their well-being and so forth. Jennifer?
I would add, for the engagement component of this work, our communities are experiencing significant engagement fatigue, particularly because of the oil and gas sector, health transformation. There's so many engagements coming to community all the time. And so we had a beautiful, fearless leader, Jess Croucher, guide the engagement process. And it was very much built in reciprocity. And so we often combined our engagement sessions with land-based opportunities. So you'll see in some of the photos there, we were always connected to the earth. We offered medicine walks. We offered a wide variety of teaching workshops, engagement sessions that involved hands-on learnings, ways of knowing, doing, and being. And then through those connections, we were able to really hone in and hear a lot of stories that many individuals shared with us over their experience. But we do believe that because of the approach of engagement, we were able to collect real meaningful data that helped shape and inspire and validated the data that Dr. Montesanti and her team have been also collecting.
So we'll skip ahead to talking about the Indigenous wellness space now as a physical space that offers wellness services. And like Jennifer said at the beginning, this was about transforming a portion of the fourth floor at the Northern Lights Regional Health Center in conjunction with a new NICU that is being developed on that floor as well. Jennifer, anything you want to share about this particular space that we haven't covered already?
I would just share that there's a lot of history in that space. There are many relatives of ours that aged in place in that space. It's a hospital where life is birthed into that space. And so culturally, there's a lot of connections. It is the only hospital in the entire Wood Buffalo region, which is a very large geographical space. So that means that our families are often visiting there. They're familiar with the space, and there's a certain level of comfort in keeping some familiarity to that space. But there's also, again, the stories of harm that that space carries. So we have a very big task ahead of us to navigate all of those components while we look at design. One of the first ways we did that was we started in ceremony. And by coming together and grounding ourselves in ceremony, we believe and we trust the Creator and the ancestors will guide this work in a meaningful way, and continue to allow us to lead with that integrity, so that the space is just right.
And so, we were able to develop a patient experience vision, a community experience vision for what this space could be, what it symbolizes for Indigenous people, what it could potentially hold as a place for healing, for gathering, for care, for connection, for belonging, as well as to learn and to heal. And through that, what are we actually talking about again when it comes to potential services and wellness offerings? We talked about how this could be a place for safety, where there would be private consultation treatment spaces for medical care. If we were to intercept patients with low acuity in emergency who required, an alternative level of care, perhaps, could we intercept them and then direct them to the wellness space where they could see a behavioral consultant or an elder or a traditional healer? It would be a place where we could offer transition beds for those awaiting discharge to make sure that we do not discharge them late at night, because we know that there are statistics where when people are discharged late at night, there is linkage to, the current phenomenon that we're seeing around murdered and missing Indigenous peoples. We also suggest, for lack of a better term, a hoteling space, a holding space, a space for comfort and hospitality where family members can reside while support is being provided to their loved one. And this is informed by the kinship model within Indigenous communities, that we know that when they show up, their community shows up behind them, right? And so it's often more than one or more than 2 or 3 family members that they're there to support them. So how do we make accommodations for that sort of thing? We also talked about access, that the Better Together, the Indigenous wellness space would be integrated, that it would be an Indigenous health team that's integrated and helps deliver community-based supports. It's a place to access traditional medicines, thinking about a traditional pharmacy. It could include culturally inclusive discharge aftercare planning, where we would network into and connected with community supports and alternative care providers. As a space, it would be a place for healing, for gathering, again, to celebrate all life stages. It would be a place for joy again, rather than a place of fear and harm. It could be a place for children to play, recognizing that there is a teaching that when children are free to play, that adults and others feel safe when they witness that. That's a teaching from Jennifer that we learned along the way. We also know the power of traditional foods. So we're proposing not only a communal kitchen, but a place for them to celebrate and prepare those foods. And alongside that, a venue for health promotion, prevention, and leveraging the lanai area that's out there as a potential place to host a healing garden. Culturally, we also have ideas around an elders and residents program, ensuring that the decor of the space reflects the culture, because we've heard that through engagement, that when they see their culture reflected back at them, they feel safe. And then this would also be a place where healthcare professionals could potentially feel safe to learn, right? Or potentially unlearn certain things. So we'll just keep going here, and I'll hand it over to Dr. Montesanti maybe to talk about the potential components of our Indigenous model of care.
Sure, thanks, Mark. So, one thing that I maybe want to just highlight is that the Indigenous wellness space is trying to change, shape 3 everyday realities: how people enter care, how they are treated while they are there, and what happens after they leave. So in terms of first, when they are arriving for care in hospital, Indigenous patients often come to the hospital in moments of crisis. I highlighted before that our administrative health data has highlighted that they are seeking care for urgent needs in hospital. And that brings about uncertainty. There's been a lot of research that's highlighted experiences of mistrust or harm, and other concerns that they've encountered. So with Better Together Project, Indigenous patients are met with Indigenous-led supports who understand the system and the social, cultural, lived realities that they are navigating. And so what this means is less confusion, less repetition of their story, and earlier support rather than waiting until distress or health concerns or conditions escalate. I think the second is around their experience inside the hospital. So, what does the day-to-day experience look like? We've had many conversations around beyond just the emergency department. How can the space be a place to support Indigenous patients who are admitted, but not just them, but their family, their support system. So this is really a space that promotes cultural safety, relational experiences within an acute care environment. Indigenous patients will be supported to understand what is happening. They will have access to Indigenous care providers who they can comfortably ask questions about their care, what's happening, what do they do after they leave hospital, as that also brings about often a lot of uncertainty and confusion or anxiety. Less repetition of their story. So advocacy is so important. Having trusted Indigenous health staff, which may be an elder, a knowledge keeper who can walk alongside them in their journey while they are receiving care in hospital. And secondly, in terms of their experience inside the hospital, just wanted to highlight that there's sometimes often tension or misunderstandings around communication. So that comes back to having trusted professionals and staff who can support them during their care journey, especially in situations or contexts where it's high stress. And then third and lastly, when they leave hospital. So I highlighted earlier around discharge. So too often discharge is where care can fall apart. The Indigenous wellness space will focus on continuity of care, helping Indigenous patients connect to other resources or community-based resources and supports that already exist in the region, whether that's related to mental health, addictions, or again, more broadly, community supports for family, and any supports really that make sense for them in terms of what they need. And this reduces the likelihood that emergency departments become the only place where they can turn. We've also recently had as a team some deep conversations around bounce back rates or readmission rates, and why that might be important to look more deeply into. So essentially, overall, this is a space, and we see, well, the Better Together project as a project is very narrowly focused on the design, creation of an Indigenous wellness space. We also see this as contributing to a larger health system transformation agenda within the northern region of Wood Buffalo. And that's really important for us because we're talking about quality of care, we're talking about patient care experiences. We're also talking about how this has opportunities and benefits for the healthcare staff too. So I hope that helps us in terms of I wanted to situate that context here rather than just run through the list that you see on the slide around these components, but seeing these components here within this context in terms of what ultimately the Indigenous wellness space is intended to be and the benefits that it provides both for the hospital as a whole, but most importantly to Indigenous patients who are navigating complex health needs within the hospital setting.
So where do we go from here? And where are we right now? Jen, do you want to provide maybe a quick synopsis on where we are and where we're headed next?
There is no quick synopsis, I don't think. You've heard us speak of the health transformation, and so I think it's important to note that when we entered into this project over 2 years ago, we entered in with partners that have now changed through no fault of their own, but through health transformation. Alberta Health Services, as we know it, has transitioned into the 4 pillars. And so we're a little bit back in that earlier stage of dating again, and we're learning who our new partners are, and understanding at a rapid pace the change that each one of them, our new partners, are going through. And as they're learning their new processes, we're just trying to do our best to stay connected. And so that is really where a big phase of what we're at right now is trying to understand the current landscape, understand who our new partners are, build in a robust strategy on how to ensure that we're journeying them along with us for this next phase. There's a whole internal government process that we're undertaking right now where we're submitting business cases and working with Alberta infrastructure and all these people to ensure that the space is really in line with the overall utilization of the fourth floor, that it's in line with how Alberta infrastructure likes to see their projects roll out. And then once we've navigated this piece, the hopeful next phase is that we would be getting into design and really looking at some of those more hands-on pieces that we can journey along with community to create. The goal would be operational in 2 to 3 years. That's a very lofty goal because we do know that there's construction and a whole process there. But that would be the ideal, is to be operational. In the interim, we're starting to explore how we can start doing, some pilots, some testing of some of these of these ideas and start really being able to benchmark and demonstrate what we believe these interventions will create a better patient experience, perhaps some pilot projects around some diversions in the ER. So that's the phase that we're at now, is really getting to the testing of our theories and we'll be able to demonstrate. I'm confident we'll demonstrate the change happening there. And I did just want to note too, I think a big part and as it relates to RhPAP and that grown your own concept of building the workforce. We know and we learned a lot from our Indigenous workforce, how they feel in their current practices. And we are very hopeful that this space will create opportunity to not only create that two-eyed seeing approach where learning and sharing around Indigenous ways of knowing and doing and being can occur, but also that we can create a space where our Indigenous workforce feels safe, proud, and able to practice within their full scope of brilliant gifts that they have. And so we really do hope that the long-term vision of this space would incorporate that opportunity to grow the workforce and create really unique opportunities to learn about how traditional healing and medicines can be incorporated into the Western worldview. And so it's another lofty goal of ours, and I'm confident that we will get there, because in order for this to be successful, in order for the entire health transformation efforts to be successful, a big component of that is creating those spaces within the work force for our Indigenous practitioners. Mark, Stephanie, I don't know if you have any other pieces you want to add to the current phase in which we're in.
No, I'd say it's an exciting time. I mean, it's sort of a blessing and a curse. A level of transformation, but also where we find ourselves being able to experiment, having time to actually, create proof of our claims, to embed those principles at Northern Lights, given that they're in a unique position to actually trial some of these things and to support the case for it. And so as a design practitioner and systems thinker / social innovator, like having dabbled in those areas, this is a really exciting time for us to look at how we can, again, restructure, reconfigure some of those resources and create a unique approach that will, hopefully inform future practices and create better outcomes for our Indigenous peoples across the province.
Yeah, I don't think I have anything else to add. Thanks for those comments, Mark and Jen. I would just say that I think it's also the project itself has offered us an opportunity to more deeply understand and appreciate the unique experiences of Indigenous peoples in the region of Wood Buffalo. And so I know there might often we get questions around how does this compare to other northern regions, and we can have those conversations for sure. I think northern, rural, remote contexts, there are some shared experiences, but there is also uniqueness. And so no story is the same, and we want to honor the stories that nation members have provided on their care experience, what their experience has been in accessing care within the region of Wood Buffalo, but also their vision, hope, and aspirations for what needs to change or how things can improve. Thinking about the 7 generations to come, and that's what they care most about. They care about the generations to come so that no other patient falls through the cracks, and that we are providing care that is holistic and aligned within their Indigenous knowledge systems, their values and preferences. So I think when we talk about transformation, it's also our transformation as a team that has been embarking on this and the immense learning that we've had throughout this process. And I just wanted to highlight that.
Well, thank you so much. I learned so much today, and I'm excited to see how this progresses. We do have some questions in the chat, so I'm just going to start at the very top one. One of the questions is very important health areas were touched on, including primary care, access to specialists, and mental health supports. How can dental care and access to dental care be supported? There is a lot of literature to indicate that many emergency department visits each year are due to dental pain, especially in the North Zone. So just a little bit of a question around those. I'm just saying that this person imagines the issues are likely exacerbated due to the diversity and rural setting of the region. So is there a way that you can address that one?
I know Jenna, so no surprise that she's asking this question because I know this is a topic dear to her heart. Yeah, no, it hasn't been a question we've overtly or deeply looked into, but I think in the context of other aspects that the Indigenous wellness space will prioritize is related to navigation, coordination, and advocacy. So perhaps not directly in terms of providing dental services and supports, but we do know that dental care is a well-recognized gap for many Indigenous patients, particularly because it often sits outside, hospital or insured primary care services and does involve a lot of complexity in terms of coverage, referral pathways, and then, acknowledging that in the context of Indigenous health. So given the Indigenous wellness space is intended or designed to help patients navigate those systems, and we're not trying to duplicate systems or clinical services that are offered within the hospital, this could be a very well scenario that might come up with Indigenous patients who are seeking care in the hospital. And especially in the context of emergency dental care as well. So in northern remote contexts, we know that often patients are being, when there's a lack of access to dental care in community, that they have to travel long distances and often wait until situations become dire or it becomes an emergency situation and need to be taken into hospital. So it has not been something that has emerged in our data, whether through engagement with communities per se or our administrative health data, but nonetheless wanted to acknowledge that is an important priority area to think about. But I think that where the space can play a role is in its broader focus around navigation and referral and coordination to other services and supports. So whether that's referral and appointments to community or regional dental providers, for example, or even in the context of advocacy, trying to navigate supports for Indigenous patients.
The only thing I would add to that, Stephanie, is we know with the Cree and the Dene Bush people up here, there's a number of tinctures and different medicines that are used for oral hygiene and health. And so another element to that referral pathway will be to those traditional knowledge keepers and elders and healers that can offer some of their traditional medicines to address some of those challenges.
Well, thank you so much. And it's great to have some questions in the chat. So I'm going to go to the next one. Just talking a little bit in regards to access and care in the language they're most comfortable with. So other than English, is there anything being done to really address those pieces to make sure that the language piece is incorporated?
Language is so important in everything we know and do. So yes, yes, of course, through the knowledge keepers, the elders in residence, multilingual signage, both the Dene and Cree languages are predominantly spoken in this region. We have some communities that are almost 90% Dene speakers. So language is so important, and it will be incorporated in a variety of ways. Currently, through our Indigenous Liaison Program, we do have access to elders and knowledge keepers that can do translations for us. And we would just hope to grow that program so that it's more readily available 24 hours a day, really, because it's just a finite amount of time that it's available right now. But we have heard tremendously through engagement, particularly in discharge planning, around not understanding what's being said to us. And so we need it in our language so we know what we're doing when we get home. And so those are some of those pieces that we will really be focusing in on to ensure that language is part of the plan because it's part of the healing.
Thank you so much. There is another question, and I think it pairs nicely with a question that in terms of how we can extend this to other rural and northern healthcare settings, what lessons we can learn, as well as how RhPAP can partner with you guys and what we can do together to implement some of these changes and learn from each other so that we can take these lessons and run with them and make sure that we can support you as well. So just wondering how RhPAP can maybe be some of that partner in this as that collaborative approach directly in the communities and outside the communities.
I think a priority area or focus for RhPAP is really about integrated care, team-based, interdisciplinary care. So I think the Indigenous wellness space is truly a unique and innovative example of integrated care. We've spoken about system navigation, coordination, referral, continuity of care. All of those highlight important values around integrated models, integrated care. So I think there's an important role for enhancing integration with community Indigenous-led services and not just hospital-based care.
I would also say that it's not the only unique and novel sort of Indigenous-led healthcare initiative that we've seen in the province with the inception of the Indigenous virtual clinic as well as the 1-800 support line. We're seeing a lot of really great outcomes from those initiatives. My team had the privilege of being part of the group that helped develop the 1-800 support line, and the way that it's grown in the utilization and the connection of care providers to patients has been really quite remarkable, right? Being able to deliver care in languages, in different languages, connecting them to people who can walk and talk and sort of walk that journey with them and guide them through and navigate healthcare systems. That has been really quite powerful. And I think this is yet another one of those additions and enhancements to our healthcare system that allow us to support Indigenous health in very different ways, in ways that they are comfortable in accessing.
And I would just add, we were very intentional when we started this work around designing the framework. And that is a gift for anybody. Once we've navigated it and, worked the bugs out a little, that framework is there for anyone else to take on and utilize and build out in the same way for their communities. And when we're at that stage, we would gladly support other communities in advising how we worked on it from our end. I would recommend anybody hold off until the health transformation the dust has settled, because it's very complex to enter into this type of unique work in a time when healthcare is being very not siloed, but pillared. And so, yeah, hold on a little bit and learn from our mistakes. And then the other piece I had was around the RhPAP components. And when you're hosting sessions for new individuals seeking to get into the healthcare profession, reminding them that there is opportunity and space for Indigenous two-eyed seeing approaches to occur in medicine. The University of Alberta, University of Calgary are working really hard with their med schools to ensure traditional components of health are included in teachings. That there's space when they're ready to come do their placements when we're operational. But really enticing the workforce to think differently about how service can be delivered and how they can bring their own individual gifts to their work every day. I think that RhPAP does a fantastic job of that, and you can just continue. And the other piece too is continue to advocate for the rural healthcare needs. We know rural healthcare is so different than urban-based delivery, and continuing to advocate for our small communities is something that RhPAP will be great at.
And if I may, I think just building on Jen's point that this is the opportunity is to really amplify an Indigenous workforce. And why that matters in the context of northern, rural, remote settings or health systems is that we know, rural and northern health systems often operate with smaller workforces, limited access, greater exposure to surges and disruptions, and higher proportions of Indigenous patients with complex needs. So how can Indigenous care providers, and in often cases, these are traditional roles that many of them have carry within their own communities or nations, what role can they play in promoting, enhancing the quality of care and experience for Indigenous patients within mainstream health systems?
I know that there's a couple of comments here. So as a U of A medical student, Jennifer is absolutely on point. As students interested in rural and Indigenous care, many of us would love to explore placement and training opportunities. The learning around traditional medicine and two-eyed seeing must continue. And then there is a question there from Nikki about PCN actively working to recruit NPs. I don't know if you can take a moment to just quickly address that before we jump to the ending of our session here. Said, I think this is a bigger issue, not specific to the PCN. Is there anything that ACA or RhPAP could do to support this? So it's possible if you wanted to address that either here or offline, we can also pass along some contact information for that.
Glad to reach out and talk further about that. I think two things that we learned when we did the profession, like the engagement with our health professions, is often Indigenous practitioners don't feel safe. And so I would really strongly suggest looking at the workplace environment, looking at how you're doing the interviews. Are you starting in smudge? Are you creating an environment that Indigenous practitioners feel welcomed to practice their brilliance? Often we hear that they aren't welcomed. Smudge for a very small example is complex to do in hospital settings. There's lots of policies around where you can and cannot smudge. And that can be, a very concerning element to practice when often we want to start in smudge as a way of healing and removing negativity and starting in a good way. So that's just one small example, but it really is looking often at the workplace and the environment in which we're inviting our Indigenous practitioners into, and ensuring that your policies are there to make them feel welcomed. And the other piece is they're few and far between right now. We are working very, very hard to increase the Indigenous workforce. But because of the harms in the past, sometimes this space just isn't the right place for them. And keep trying. That's my words. Don't give up, because we will be able to grow that space.
All right. Thank you so much. Really appreciate all the learning and all the learning that we have yet to do. So it's been a really great session. I want to thank all of our speakers here for coming on, for all of the information they presented. Thank you so much for joining us today, and I'd love to wish you a wonderful rest of your week.